Welcome to another episode of the Wellness Moment, brought to you by Dignity Health Foundation, the East Valley. Guys, you guys know all about this. It's awareness time. It's the time where we bring information to you. Knowledge is everything. We said before, if you don't listen to your body, you don't hear what's going on within your own self, it's hard to understand everything. And when you don't understand what's going on, you don't know can you fix things. And if you can't fix things, well, that's when trouble happens. So very fortunate that Dignity's bringing us together to give you this information, and it gets even better tonight. We got another doctor in the house, Dr. Dan Sraow. Doctor, how you doing tonight?
I'm doing well. So thank you for having me, and thank you for having my staff here from the Structural Heart Program from Chandler Regional Hospital. It's quite a pleasure to be here, so thank you.
Hey, I want to talk to you about the field that you're involved with and how you and Dignity are involved.
So the field that we're involved in is actually quite innovative. We're bringing a new technology to at least the Southeast Valley and to the community that probably needs it most. So what structural heart is we fix valves in the heart without cracking the chest open. So previously, if you had a severe heart problem with any of your valves, the only option would be open heart surgery. And it turned out that there's so many patients that are just too frail for that. And a lot of them were being turned away. About 40% of them were being turned away. And we're filling that void. And our whole program is taking those patients and doing it from a minimally invasive approach. So actually, we're doing it without any surgery. We're doing it through the groin, and we're able to fix pretty much any valve that a patient has a problem with.
Going through the groin, that's something that I would never even imagine that you can do a treatment or a procedure that's got nothing going on with actual growing itself.
No, so essentially it's actually from the side of the leg, you have a major heart artery, a major artery that goes up to the heart.
Okay.
And it's big enough for us to put equipment up, and we can track that through a wire into the heart, and then we could actually fix the heart valve through that. And then on the way out, we could just basically either hold pressure or we can close it with a closure device. And we essentially have patients walking around within 8 hours with a new valve, which is honestly, it's just amazing.
Wow, modern science and everything, all the things that you could do today. That's good stuff. Hey, talk about the success that the TAVR program has been having with the patients that you've actually performed this on, and some of their success stories that you've actually witnessed yourself.
Okay. There's so many success stories. Like, you wouldn't believe how gratifying this is. It's literally, I do heart attacks. I do, people like losing their legs, and I'm saving the legs. But this is essentially my favorite thing to do because the success stories, as you mentioned. So we have 99-year-olds that were golfing, and then valve problems caught up to them, and they weren't able to do the things that they love to do, including golf. And when we fixed it, we got them back on the golf course. I had guys that basically were completely dependent on their family members, and which obviously gives a lot of kind of strain on their caregivers and their children, who are now traveling across the entire nation, going to Seattle, and it's absolutely amazing. And I have ladies who they were essentially debilitated, and now I have to tell them to be responsible because they're running around vacuuming the whole house and doing the stuff that they were used to that they just essentially couldn't do for years. And
it's that new lease on life that people are getting. It's exciting, though.
I know. And so I had to even tell the patient, because one time, the daughter told me, she's almost crying. She's like, thank you so much that, you brought this kind of life back to my mother. But she's like running around so much with a vacuum that she tripped over the cord. So I had to tell her, this elderly lady, hold her by the hand, and her name's Helen. And I'm like, Helen, just because we fixed your valve, you can't be reckless. You're not a teenager. And she's like, I know, doctor. But it's amazing because they feel so much better that they want to do the things they enjoy. And she happened to enjoy, taking care of the household. Like, she was proud of it. And she got to do it again.
Well, let me ask you this. Taking care of a procedure, doing a procedure, which obviously that's your forte, you're very comfortable doing what you're doing, and you've got the track record to prove it. Is it more rewarding, though, when you can hear the joy in a person's voice when you do a follow-up consultation? And, that's more like one of the MasterCard priceless moments, would you say?
100%. That's actually the best part of it. And so our program is very big, and we're very busy. So essentially, we're getting referrals from other cardiologists, and we're getting referrals from other doctors all over the East Valley. And, our responsibility is to take care of the valve and then send them back to their doctor who very, very, wisely chose to send them to us. So we always have this kind of, they're so happy. Oh, doctor, can I see you again? And it's almost like a breakup moment when, I have to tell them again, hold them by the hand and say, hey, we fixed your valve. You can't see me anymore. They're like, but can we please? And I'm like, no, your doctor did the right thing. They sent you to us. And it's so gratifying. And then afterwards, they will say, at least I will not leave without a hug. Like male, female patients, they're so happy about how they feel that they'll say, they're like, okay. And then, and then you hug it out, and I tell them, the next time I see you, it's going to be in the shopping mall, it's going to be on the golf course, it's going to be, out on the street, jogging. So that is probably the most gratifying part of the procedure. You hit the nail right on the head.
That's good stuff. Hey, I want to ask you right now, can you explain how Dignity Health has been instrumental in all this?
Oh, so Dignity, they recognize the need. The need is so undermet, and especially in the Southeast Valley. So Dignity took the bull by the horns, and they said, we need to do something about it. And they really, financially, and then with personnel, they completely backed up the program, and they also backed it up from kind of a publicity standpoint, and they knew that we needed it, and Dignity has been completely instrumental. This program that we started, so we already had a program downtown, and Dignity started that. It's a very, very excellent program at St. Joe's, and I was a part of that program, and they realized that we needed more. They knew that this need was not met, so they wanted to start another one, and it was started honestly at lightning speed. If you compared what they did to programs across the country, and I've been at very big programs. I was trained at Cleveland Clinic, is considered one of the biggest heart hospitals in the country. I was in one of the biggest centers in New York. Dignity was able to do it in what I consider lightning speed. And they knew it. That is because that our community needs it.
That's just good stuff. Anything that Dignity Health puts their name on, it's got to be good. You guys know it's got to be beneficial to the public, to every guys or ladies or children. It doesn't matter what age group you are at. There's going to be something that Dignity Health Foundation East Valley can do for you. You guys have seen it. Last week we had children, oral, going through the dental procedures and everything. And now we're bringing you a procedure that I personally had no knowledge of. So this is news to me. So it's knowledge to me. So if somebody asks me about it, I can at least have some sort of understanding of what you're doing, have some sort of understanding of what your practice is. And it's exciting for me. And to get any information on what Dignity Health can do for you, or just, it's all about human kindness. I know they're trying to go in a different direction than not use #human kindness, but human kindness is what it is. You can go and you can visit dignityhealth.org/giving. You can do anything you need to do about upcoming programs they've got, whether you want to make donations or you want to find out how can you help out, maybe just volunteer your time. Again, if Dignity Health is putting their name on something, it's got to be beneficial. When we come back, we're going to talk to one of your patients. I believe it's going to be his son. Randy's going to come on. He's going to talk about the procedure that you did for his father. So that's going to be kind of like one of those MasterCard commercials again, where you actually get to relive this moment again. And, you know, I mean, again, it goes back to, we said this earlier, knowing that you did the procedure, but just hearing the aftermath and hearing the joy in people's voices, and then, of course, seeing them live that next chapter. Guys, it's always great to be able to do this. And like I said, it's Wellness Moment with Dignity Health Foundation at the East Valley. It's great stuff. When we come back, we're going to, like I said, we're going to talk to the patient that doctor was able to perform this surgery on and procedure on, and we'll get more information on that. Catch you after the break.
You're better than the best. I'm lucky just to linger in your life.
Oh, I hope you guys enjoyed the first segment of this. Again, knowledge is power. Anytime we can bring you this type of knowledge to better yourself, it's definitely on the plus side. Doctor, before we go and bring on the guest son that you actually did the procedure on, we talked about the first segment about some recovery times in this procedure. You made a mention that it's 8 hours. They're done, and then you said something about the fact they can leave the hospital within a 36-hour period.
Well, actually, 50% of our patients are gone within 24 hours.
It's even better.
Yeah. So this procedure, the recovery is quite exceptional. If you compare it to a surgical valve where you're getting your, whole chest opened up, you're pretty much going to be in the ICU for 3-4 days. You're going to get out of the hospital in 7 days. It's a very traumatic thing. And it turns out that this modality is actually as good, and now studies are showing that people do even better. Here's why. So we're having people, we're doing the procedure. It takes about, for me, 30 to 45 minutes to do the procedure portion. And we have them eating afterwards. I'm having them sitting up in a chair in 4 hours. They're walking in 8 hours. Then they're doing laps the next day around the floor. And I'm telling them I want 5 laps. And 50% of the time, I'm telling him, as a doctor, I can't even justify keeping you in the hospital. And they said, Randy, who's calling in, his father, when I made him do his laps, he kind of made this muscle, Rocky sign, and then said, I feel like I did when I was 20 years old. And I said, I can't keep you here. So people are leaving in 24 hours. But generally we tell people 48 hours, but it's not unusual. Like I said, 50% of our people they're going to be on the next day.
That's good stuff. Hey, you know what? Since we talked about Randy, Randy's actually called in right now. Let's go ahead and bring Randy on. Randy, how you doing tonight? Randy, you there?
Oh, good evening. Hello, Dr. Sraow.
Hey, Randy.
Hey, Randy, I want to go ahead and talk to you about the procedure that your dad had by doctor, and the fact that it was one of the first within the Chandler program.
Right. Yeah, it gives me chills just hearing Dr. Sraow. What an amazing doctor. My dad is a rocket. He went in with strong hesitation just because he's very, very stubborn. He turned Dr. Sraow and the Dignity Health just turned his life around. He did not want to go through anything. He went in one day to his doctors to just get a regular checkup, his regular MD, and they said, oh, your heart is racing. He went in and they said, you need to go to emergency, sir. And this was in March when I was in real estate school last year. I was switching careers, but I got a call and said, your father's in emergency. He's okay, but his heart is just racing. Well, several months later, working with, Dr. Sraow and the great facilities at Chandler Hospital, they were able to make my father a new person. In fact, today, Dr. Sraow, you'll be very proud. I took my dad to lunch, and we walked around the mall at Chandler Fashion Center, and he was passing me up again, and he's got this vitality for a whole new life, and he's turning 86 this May.
That's awesome.
That's definitely good stuff. Hey, describe some of the changes that you see in your dad today.
He actually walks faster than me. Again, he's turning 86 in May. He cooks in the kitchen. He walks around the community. He's being very social with more people in the neighborhood. Before, he would lose his breath when he would walk to the mailbox, or when he would just walk down just to feel like, because he was in the Navy. My father's a veteran, and he always felt proud, to be vocal, be around, be present with other people. And for many years, I've seen him decline, and I just was like, all right, my father is in this new stage of life, and it was progressing to the point where it just broke my heart. So I guess, the Lord says things happen for a reason, but when he went into his doctors and identified he needed the heart valve, and he was one of the first patients, like you mentioned, at the Chandler Hospital, or that week of, to receive it. He was out in less than 24 hours and feeling like, he said he was in his 20s going into the Navy back in Detroit, Michigan.
I mean, that's got to be good stuff. I mean, to be able to get a second lease on life, and then for you to be so close to witness it, and then to be able to share this with the doctor that actually performed the procedure, and just have that bond. Because you know what I mean, when you go through something like this, it is a tragic situation in life, and then you go through the procedure, and it almost brings the doctor becomes a part, an extension of your own family, because he was able to do this for not just you and your family, but for your dad.
Yeah, very, very resounding statement you just said. Correct. I had family members flying in from different states just to be part of the process, and it was like a new birth for someone who's senior to get a new valve like that and to have a rejuvenation of life. Even today, he said, "Oh, Dr. Sraow said I got 10, 15 more years," and he's planning. We're going to a wedding this summer in Michigan to his grandson, and he's traveled to Seattle. He's traveled to Boston. He's on planes. He's no jet setter by any means, but before he used to, not have the ability or the stamina really to do this type of travel after our mom passed 2 years ago, and he beats me out. He's just a little rock star. He's walking through just enjoying his new life, and we appreciate everything that Dr. Sraow and his team have done.
Great. Hey, Randy, I want to go ahead and thank you for taking time, calling in, and sharing that story, a personal story with us and with the audience here. You have a good night, and again, hopefully your dad's doing well. Doctor, you want to say anything before Randy goes?
Randy, I'm so happy to hear how your dad's doing. It really just made my night.
We talked about you today. You're a blessing. Thank you so much. And, continue doing what you're doing to help people with their lives. Thank you for having me on the show. You both enjoy your evening.
Thank you so much.
Thank you. Doc, it's got to be good. It just like we talked about before, when you can hear the stories that the patients can bring to you, you can share that moment. I saw you light up when he was talking about his dad lapping him in the mall. I mean,
I just love it, because this is what they do. I have just story after story after story of, people even in their 90s, they just start acting like they're teenagers. They feel that much better, and they're just so happy, and they want to celebrate. And, it's the most gratifying thing that I've done.
Well, that's the good stuff. Hey, I want to mention to you guys about an upcoming event, and it's right around the corner, as in tomorrow. It's a promotional event. Join Coach Darlene Santor, for an amazing weekend of purpose. April 7th and 8th at the Grand Sheridan at the Wild Horse Pass. Events of all weekend with the proceeds to support wellness and kindness in the East Valley. To learn more about this, you can go to laughingforacause.org. Guys, it doesn't get any better than this. I mean, there's programs they're doing. There's procedures they're doing. There's information that they're doing. I mean, again, I go back to is if Dignity Health Foundation is putting their name, they're tagging themselves on a program or on something, you want to take advantage of it. What? You read something, if you don't like it, well, then you move on. But if you read something and it hits home, then there's something that you can do about it. And it doesn't get any better than that. Rex Albright, you made a point of bringing me involved in, bringing this to our listeners on a sports show. So I can't be more thankful for enough for you that. Doctor, I definitely appreciate you coming in, sharing all this.
Well, thank you.
I know you got your staff members here, and they've been just great, just being cheerleaders, but it's been all good. Guys, it's been another great wellness moment by Dignity Health Foundation. This moment puts human kindness in action, and you can go ahead and reach out by giving today. To go to dignityhealth.org/giving. It's been a great 5 weeks. I hope you guys have got as much out of it as I have. Thanks again for listening, and I'm sure when Dignity Health and I come back together again, I'll be sure and let you guys know. Have a good night.